when those products were initially designed, it's more as if we're applying engineering design principles and designing something in a CAD software one of one, taking maybe 5+ hours to design a single product. Most of the standard design templates that I was just talking about are able to create a finished product based on a 3D scan in less than 5 minutes. And that's the business that we've created and positioned ourselves for scale in a custom product business. So mass customization of 3D printed medical orthoses.
Welcome to Triangle Tweener Talks, a weekly podcast by builders for builders where we explore the startup journey from the idea to the exit and all the lessons in between, with an exclusive focus on founders from the Triangle region of North Carolina. Now here's your host, serial founder and general partner of the Triangle Tweener Fund, Scott Wingo.
First, a huge thank you to our gold sponsors. Today we are featuring Eisner-Amper. Whether you're planning international expansion, M&A, or IPO, Eisner-Amper offers stage-specific solutions to help you reach your next milestone. Our dedicated technology practice delivers hands-on outsourcing, accounting, tax, and advisory support. We'd also like to recognize our silver sponsors. Today we are featuring Bank of America. B of A's transformative tech group helps tech companies scale fast with hands-on support, world-class resources, and an extensive network. Thank you again to all of our sponsors for supporting Triangle Tweener Talks and the entire Triangle startup community. It takes an ecosystem to build a thriving community, and sponsors like these are very valuable, and they contribute their time and also help sponsor things like the Triangle Tweener Talks and Triangle Tweener Times. Thank you. Welcome to this episode of North Carolina Tweener Talks. On this episode, I host Kevin Gehsmann. He is the CEO and co-founder of PROTECT3D. They are based out of Durham, North Carolina, and Kevin and his co-founder were football players at Duke. One of their buddies had an injury, and being mechanical engineers, they decided they could use 3D printers to create a custom solution. That then became the idea that sparked their company, PROTECT3D. It's a fascinating story. I love these folks that start their companies in the college level. We're seeing more and more of that here at Tweener Fund. It's pretty wild and just a testament to our tier one level research universities here in North Carolina and how they are many times the start of the flywheel for founders. Kevin is one of the most, he's got the most grit, but he's also the most humble person you'll ever meet. He doesn't do any bragging on this one. I had to nudge him to brag a little bit. Finally got him to open up a little bit more than maybe usual. But just super, super nice people doing great work at a human level. And, I build software for helping people with e-commerce, which is fun, but helping people that have had injuries, that's another matter. And it is a huge kind of answer to the why behind why he and his team do what they do. I found it to be a great conversation for the founders out there. Lots of good founder lessons here. We hit some of them kind of towards the end, so make sure you stick around for that. And without further ado, here is Kevin, CEO and co-founder of PROTECT3D. Welcome to today's episode of North Carolina Tweener Talks. I'm your host, Scott Wingo, and I'm being joined by the CEO and co-founder of PROTECT3D, Kevin Gehsmann. Kevin, welcome to the show.
Scott, thanks for having me. Happy to be here.
Absolutely. I feel like I've known you for probably 4 or 5 years, but let's tell folks that aren't familiar with PROTECT3D and you a little bit about the Kevin backstory, and then we'll get into kind of the backstory of why you decided to found PROTECT3D.
Can do. I am a Greensboro, North Carolina native, and went to Duke University, studied mechanical engineering, did the innovation entrepreneurship certificate there while playing on the football team.
So wait, a football player that got a mechanical engineering degree. How that's somewhat rare, I've got to imagine.
I believe one of 7 in my time at Duke.
What position did you play?
So linebacker during the Coach Cutcliffe era. We went to 3 out of 4 bowl games, won all 3, and beat UNC 3 out of 4 years.
Very cool. Congrats. I guess that's a big part of the being a Duke player is beating UNC. What got you interested in entrepreneurship? So you kind of knew at college, it sounds like that was something that you were at least intellectually curious about.
There were a lot of things at Duke that drew me to the Innovation Entrepreneurship Certificate. One, I needed not problem set and lab class to balance the engineering curriculum. So it was great to have some case studies around entrepreneurship there. But the more I got into it, the more interested I was. But definitely did not take that minor or certificate program with hopes of starting a company. That took place our senior year when this idea really came about.
So let's talk about that. What inspired you?
Yeah, what sparked the interest in the company was a 3D printed custom bracing product for our teammate. We had tinkered with this technology at the time, and I mean my teammate on the Duke football team and co-founder in the business, where we were just really doing this as an extracurricular activity. And when our teammate Daniel Jones, the starting quarterback at the time and now Indianapolis Colts quarterback, went down with a clavicle fracture, this was the perfect time to deploy this technology and use it in a game setting. So we collaborated with the athletic training staff. We collaborated with some engineering faculty members of how can we scan this athlete, digitally design a product to perfectly fit the torso, and 3D print it in a strong enough material to hold up in a football game. And the resulting product was something that was better than anything the elite medical staffs had access to.
So before you guys came along, if I needed a certain type of a brace or something, it would be like one of these elaborate things that was designed for any body shape, any person, from a sprinter to a football player, who obviously have different body shapes by just kind of definition. And then as a result of that, it doesn't really fit your form. So for your leg or something, it's going to have lots of Velcro straps and things, and like lots of hard plastic. And even with Velcro straps, it will not contour to the shape of every human body is wildly different. And and so that's where you guys come in.
That's exactly right. I think athletes or patients or medical professionals are torn between grabbing an off-the-shelf piece of equipment or brace, and we say it now in the company day as a one-size-fits-none product, or they're using heated plastic to hand mold thermoplastics and attempt to get a custom fit. But you're left with bulky and uncomfortable things that can inhibit your play. So when we're able to make something totally custom for these use cases, athletes don't notice they're wearing anything at all.
I imagine there's probably a lot of solutions for 3D printing. They kind of provide this middle ground where there's like nothing, and then a super high end bespoke kind of a thing that's hundreds of thousands of dollars or something like that. Does that exist in your world? Are you like in the middle, or there is no like super duper high end thing?
Yeah, I think when we were in undergrad considering whether to start the business or not, it became a unit economics game, and we're using not the highest end 3D printers and able to make these custom solutions for low cost and charge our customers reasonable cost for really high end products. So it's not as hundreds of thousands of dollars for these custom bracing products. It's a faster, more robust product for a reasonable price tag.
And because the materials and everything is so inexpensive, I imagine in the early days you were still doing a little bit of trial and error, because back then the scanning technology, even though we're only talking like 6-7 years ago, the scanning technology probably wasn't as robust as it is now. So maybe you'd have to kind of like scan one time, something was a little off, scan again, make sure you got that the curve of the elbow or something really nailed. But because it's 3D printing and it's here locally, you can do a little bit of trial and error. It's kind of like in manufacturing, they call it like prototype layer. So it's easy to like prototype 1, 2, 3, 4 pretty quickly. And not the bad thing about the super expensive is you commit, you're committed, right? Like it's a kind of it uses things like injection molding that are so expensive and kind of quote unquote permanent that it's hard to start there on many things. Is that another benefit of what you guys do? That's
exactly right. For injection molding, it costs a bunch of money to get the initial mold, and then that's going to be your design long term. For 3D printing, we're taking advantage of rapid prototyping and iterative design to get to the just right solution. we leverage 3D printing for a lot of reasons that it's beneficial. That's including unique geometries that are only possible with additive manufacturing, customization. Each product is one of one, matched to the anatomical scans that we're taking, and that low cost barrier.
You and a classmate, you solved the quarterback's problem, and then did you start the company then, or like what happened next?
Yeah, this became our senior engineering capstone project, where we had sort of the perfect capstone advisor, and Dr. Ken Gall, who is the founder of local 3D printing titanium implant company, Restore 3D, and they do patient-specific implants, metal 3D printed. And he runs a 3D printing lab at Duke Engineering. So it was really, and he's a serial entrepreneur in the orthopedic device space. So really a tremendous advisor for us in that capstone program, and gave us the proving ground of, well, if you're going to go into commercialization around this product and this technology, here's a roadmap that has worked pretty well for another person in the space. And that has just held true to so many people in the Triangle. It's an amazing community to start a business. And
what'd you make on your capstone project?
I think an A, maybe even an A minus.
Typical entrepreneur. You're like, no one's ever asked me that one yet. And then did you decide to start a business?
Then we decided to start a business. We got some notoriety for creating some products for high level athletes during the capstone, made some products in a team setting for maybe the Duke lacrosse team. And by the time we were in the little accelerator program through Duke I&E that summer, we're starting the business, won a small grant from the Pratt School of Engineering that bought our first 3D printer. So the first ever commercial products were 3D printed on my apartment kitchen table and delivered to sports teams around the Triangle, hand delivered. And we'll look back and chuckle at what those products looked like. And
then at that point, did you take the formal step of incorporating and things of that nature and start fundraising, or when did you guys realize that this was going to be so the I&E, those dollars always run out faster than you want them to, then what was the next step? Yeah, that summer, I guess, really before we made the graduated in May, incorporated in August, and in that time had commitments for an initial friends and family round of $175,000 on top of the $10K grant. And then that fall, we're in the NC IDEA micro grant cycle. Oh, great. Yeah. I did not know that before you came on. So we just announced that we're going statewide and partnering with NC IDEA. I don't know if you saw that or not. I did. Congrats to the NC Tweener. Thanks. So part of our thesis is that we have a lot of overlap, and we're kind of serving the same communities. We should partner together and double both of our efforts. So that's awesome that you received one of those as well. And then one of the things that so to kind of tell the story of the business and how it developed from kind of the kitchen table printer. And I imagine this is going to be super nerdy but that's how we roll on this show. So your kind of standard off the shelf 3D printer uses, what is it, PLC? What's the three-letter acronym? PLA, sorry. Yeah, PLA, which is a very brittle, hard plastic, which has some benefits. It's good if you're doing like a little Yoda statue or a little something like that, or like one of the many. There's three things. All these things print. Like I remember the MakerBot, the early ones was like the old school. It's this extruded plastic. I imagine you're going to need things that are going to have a lot more flex to them, be more resilient. Those will shatter if they take an impact. And if you're out, if someone's wearing this in a game-like experience, you don't want that to happen. Did you quickly progress out of PLA into different types of materials? We did. I think that was one of the core initiatives during the capstone is what is the cost-effective model. We tested maybe 5-10 different types of 3D printers, did material testing and impact testing for what would be the right combination to do here. So by the time we started the company, we kind of had the 3D printer that we wanted, and there's differences between that FDM sort of feeding a plastic through a heated nozzle printing versus doing the resin type printing that is essentially going liquid to solid and building it out of that pool of liquid
and now sort of the highest end 3D printing of doing powder printing, where it's a thermal source that is essentially sintering that powder together. So we leverage all of the 3D printing technologies and a variety of different materials for different products. So a stiffer product, if the upper extremity, like an arm, is needed to be fully immobilized, and we make a totally 3D printed waterproof cast replacement that somebody can swim in. We make a face mask in basketball that absorbs energy and is designed to withstand those forces. We make foot orthotics that you walk on and are built in an energy absorbing lattice structure that create a nice rebound effect as you're walking.
I've had the pleasure of owning some SLS printers, and it's the closest thing to I forget the Star Trek name, but the fabricator thing on Star Trek, where you put this model in to this little flaky material, and then it does its thing. It cooks for a while, and then you open it up, and then that material falls away, and this solid object is there in the middle. It's like the most amazing thing ever, SLS printing. Can you say, are you able to say which kind of ones you're using, or is that proprietary?
I would say it's proprietary. We use a variety of all three, and we have a product SKU of 30 products, and we kind of choose the right material makeup for each one.
Yeah. So let's fast forward to today. Show us some the types that, and if you're on audio, we'll do our best to describe this, but this is where, being on our YouTube channel may be helpful, because this is a very visual kind of a company that Kevin and his co-founder have created. So show us like an example of what this looks like.
Yeah, happy to. And maybe easy to describe our 3-step process now and how it works for our customers too. So you asked where this has gone from apartment kitchen table 3D printing to today. Back then, we were traveling around the country to do 3D scans. So at one point, I showed up at the San Francisco 49ers facility to scan somebody and have a product delivered there a couple days later. Now the scans are done on an iPhone app. You can choose that you want a thumb splint or a rib pad or a face mask. The app guides our medical client through how to scan the anatomy for those products. It uses the front-facing true depth camera to do one of those scans. And I'll put that on screen to see how quick it is.
Yeah. So while we're doing that, in the olden days, the scanning technology was finicky and okay.
When we first started, when we first scanned Daniel as students, we were using a handheld white light scanner that could get micrometer precision. The true depth sensor on the phone, which is, as I'm navigating, if we can see the video, around an athlete picking up the face that fills in as you go. It's essentially what unlocks your phone with biometric Face ID and makes it like a point cloud, filling in more data as you navigate around, staying about a foot away from the anatomy that you're working with. And that feeds our digital design system to make a custom face mask.
Got it. Very cool.
So then I would describe, Scott, the core technology of the business, and the proprietary aspects here are the algorithmically driven automated approach. We've essentially built a CAD system around digitally fabricating custom products. So we feed this in to our design tools. We're recognizing anatomical features, and really the program is running to design a custom face mask based on the parameterized metrics that we've done this for hundreds of products in the past.
Yeah, it's one of one, 100% custom designed to fit this athlete's face. Unless they had a twin, it wouldn't really fit on anyone else. So, so that's the downside. Is it is extremely custom, but that's the benefit, right? Because that is going to enable this to have much better cushioning and protection for this particular athlete.
Exactly right. And then showing a variety of digital products too. This would be an ankle foot orthosis that is becoming like a walking boot replacement in some injuries. It doesn't immobilize the foot. Instead, it is designed to bend and spring back, be worn inside somebody's shoes. And skipping to today, on the commercialization landscape of this is now an insurance-reimbursable product that is offered by some of the clinicians in our local Triangle and greater North Carolina area.
And imagine you have to work really closely with the medical folks to kind of say, what do you want to move and what do you not want to move? Like, tell us exactly how you want this device to be, deliver the medical benefit that you're trying to get from such a device, and have it be pretty customized in that way as well.
That's exactly right. We essentially partner with these medical professionals where they're our customer and they're scanning and having products made for their patients. They know what our sort of template or standard product design looks like, and they know that they can collaborate with us and have nuances such as the thumb splint on screen here going a bit further to immobilize one more joint or one less joint, and things like that. We operate as a design team and provide design services if they need specialized things on top of our standard design products, where we can have a little bit of fixed prices for these fully custom products.
Before I jumped in there, you were going through the three things. So there was scan. What are the three pieces again?
So that digital scan that takes place on our iPhone app, the proprietary digital fabrication, so the design step that is employing these digital design tools, and then just the actual 3D printing that we're doing in our facility and making products like this. So here's the face mask. We'll put foam on the inside that's laser cut in our system and designed just right. Here would be that ankle foot orthosis that's designed to bend and have some energy return through gait. And then that CMC brace or thumb splint that we saw as well with a nice branded strap. So each of those has their own device and their own 3D printing process, their own design process, and their own pathologies or diagnoses that are leading doctors to recommend these products.
Yeah. And, I love these types of companies that they touch both a digital component and a real world component, because in this AI world, I'm sure you've seen all the SaaS apocalypse and all these kinds of things. There's a physicality to this. You've got a mini manufacturing kind of capability here. And because it's one of one, it's going to be hard. And I'm sure you've done some things. There's a lot of proprietary things that create moats, but just kind of like being a service bureau that's going to do all those three things in a very unique way. You have the proprietary nature of the data you're gathering over time, right? And so I'm sure you're starting to see enough shots on goal on these things, and you start to see some clustering, like the ankle one that has now become, you probably have enough flavors of that, even though it's customized. There's enough flavors of that you can really specialize on it. That's the kind of thing that someone trying to compete with you, it's going to take a very long time for them to figure out and build that. But even then, just like as you guys have done this, even I've seen you go from, really automating different pieces of it and making it much more efficient. Like even just stitching together the scans, I'm sure in the OG kitchen table, that was like non-trivial problem. And I'm now sure you've got pieces, software that kind of like manages that aspect.
Yeah, to try to put some numbers behind that, when those products were initially designed, it's more as if we're applying engineering design principles and designing something in a CAD software one of one, taking maybe 5+ hours to design a single product. Most of the standard design templates that I was just talking about are able to create a finished product based on a 3D scan in less than 5 minutes. And that's the business that we've created and positioned ourselves for scale in a custom product business. So mass customization of 3D printed medical orthoses is how I would describe that.
So far, you've talked about athletes in the Triangle. Have you been able to expand outside the Triangle area?
Definitely. And I talk about the athletic space as that's been where our product started and where this company originated is in the college football world. But we won an NFL Health and Safety Innovation Award in our early years. And that helped us get on to the field and in the sports medicine rooms of some of the top NFL teams. We now work prominently with over half of the NFL teams. We have a great nationwide distribution in college and professional football, in the NBA, in the WNBA. Really, that face mask product that I showed is the most popular. We've become the go-to source for facial protection in these settings, and that seems like a niche product. But there are quite a few facial injuries in not only professional sports but everyday sports too.
Is it applicable outside of sports?
It definitely is. So I mentioned some of those insurance-reimbursable products as we've scaled this company outside of just really what I would describe now as our beachhead market and an amazing branding opportunity in collegiate and professional athletics into the general orthopedic community, where these products are routinely prescribed by Duke Health or Raleigh Orthopedics, Ortho Carolina down in Charlotte, or UCLA Podiatry on the other side of the country, Baylor Scott and White in Dallas, Texas. We have leaned into durable medical equipment, bracing distribution partners to help us scale and grow that commercial side of this business. So I have a handful of our products that are insurance reimbursable and making this really work at scale and in traditional sales channels.
It's hard to talk about Duke football and entrepreneurship in the Triangle without another name coming up. I'm sure you get this a lot, but you must know the Teamworks guys. They're several steps ahead of you. So Zach and Mitch, do you guys? It seems like a natural. I don't think the company should be together or anything, but like they're talking to a lot of the same people you're talking about. Have they been? I assume that you know them and they're aware of what you're doing. Like,
yeah, Zach and Mitch are very supportive of us, and Mitch has done a great job and really become like a mentor of ours in the founder community. But being right down the road, we've hosted some of our all hands meetings in their team room. They have a locker room style turf field and a pretty good athletics feel.
Yeah, it's really clever. Yeah, they're neat. Do you cuss as much as Zach does?
No, I certainly do not.
You seem like you're cleaner cut. Yeah, that's like always people are going to go meet him. We're like, now this is going to sound strange, but he cusses like a sailor, and they're like, what? I was like, you'll see. Just like prepare yourself. Don't be shocked. It's funny.
Yeah, they've just done an amazing job being a centerpiece of really almost all professional collegiate sports programs. That it's incredible. I used it as a college athlete, but now it's a centerpiece of health, wellness, sports, scheduling, and communications.
What is it with the Duke football team and entrepreneurship? Is that is it just like an oddball thing that there's four of you guys, or like what is that like? What is that? Is it a Duke thing?
I think it might be a Duke thing. As Manny Diaz said when he was taking the head coaching job, there's something special about Duke.
Just bleeding blue causes it. I think it's because Duke has done a really good job of integrating entrepreneurship in all kinds. It's not just in the business department or the engineering department. It's kind of like campus wide, and it even goes through to like Duke Capital Partners. I don't know if I assume that they are they on the cap table, or did that not line up? Or
they're not. That has not lined up.
We'll get them next time. But even then, like the tech transfer, they just kind of have like 80 different intersection points that are, and most of them are integrated. And there's also not like a weird, like being a football player, you could go to the MBA program and that wouldn't be different. And I think, so something about Duke has done a really good job of integrating entrepreneurship. And I think it's all of our local universities could learn a little bit from it. And I think, certainly people outside the Triangle were very oddball in that, like all three universities are like really big in entrepreneurship. And, I think it's pretty rare that happens. Like if you went to Florida, you could probably find 2 out of like 8. And certainly in South Carolina, where I'm from, it's kind of they're kind of the misfit toys there. But at Duke, it's just kind of like it's almost like a leg of the stool or a pillar of the university is this idea of entrepreneurship.
I've certainly benefited from that, being in the I&E program, and the Melissa and Doug entrepreneurship program has been something that I was a part of, and now that's become interdepartmental to be a freshman and undergrad, just got on campus, but has a startup that they want to progress, or a second-year business school student that's going into VC that bring that community together and create a community around it, I think it's pretty special.
Yeah, thanks for mentioning Melissa and Doug. I always forget that in the list of things that are there, but they've done a great job of giving back as well. So there's it's definitely a great community there. I'm not a part of the school community, but I go speak there all the time and love hanging out with the Duke students. They ask all the students at all our universities now. I've done this for like 20 years. Like the level of questions I get is like crazy compared to 20 years ago. It's like, why are you doing this? Why didn't you get a job at IBM? Kind of thing. And like, how do you come up with these weird ideas? And then now it's like, when you get a safe or a convertible note, how do you think about comparing those two as a investment vehicle? And, how do you springboard from that into your price round? And what should we look for as gotchas in a term sheet? I'm like, holy cow, you guys are you're jumping right into the deep end on these questions. Like I kind of miss the days. It's like, how do you come up with ideas? Like those are a little bit easier to swat down. Have you gone back to any classes in spoken?
I have, yeah. I had the pleasure to go to a Fuqua class and present to the VCIC group that was going into some of those venture capital competitions from an MBA program perspective. And then actually a couple months later, I spoke at the UNC Business School class in a similar capacity. So was able to pitch the company and give like sort of a practice session for them to Q&A a founder. So those were both awesome ways to give back, but also to practice pitching, to be out on the fundraising trail again this year.
Was the stat about how many times you beat the Tar Heels part of your pitch?
I said that in the Fuqua part and withheld that in the Keenan Flagler presentation.
Until after they voted. And if you didn't win, you're like, oh, one thing I forgot. Yeah, just kidding. This is part of it. We're recording this right before March. So this is part of the fun of the triangle, is the friendly trash talking amongst the North Carolina universities.
Yeah, now as a business, we're fans of anybody that wears 3D printed custom protective equipment. So I am a Tar Heel fan every now and again. I'm a Wolfpack fan, definitely a Carolina Hurricanes supporter, and it goes well beyond that. A small percentage of people take rivalries to like a silly place, but you're helping human beings deal with injuries, and that's kind of a serious matter. If it's the Tar Heel quarterback or the NC State quarterback or any football player, you have that corps d'esprit with fellow athletes that what it takes to be a college athlete is not an easy undertaking, and every injury is scary and a very life serious event for every athlete, and you guys coming and helping them, I'm speaking for you, but that's got to override the simple little rivalry kind of fun thing. So it absolutely does, and that speaks to the why of the business, is the impact that it has on people, and everybody that works at our company feels that, and it drives us on a daily basis. So give us I don't want you to reveal any super secret info, but full disclosure, we're an investor, so we were excited to be able to come along for the ride there. Thanks for letting us hop on the cap table, even though it's small. We're do lots of smaller checks, but happy to be supportive however we can. Where's the business now? How much have you raised, and where do you see this going? Yeah, and thank you to the North Carolina Tweener Fund for participating in the last round, and we hope to keep that index looking as positive as it is. The company has raised around $5.5 million to date, with 1.4 being non-dilutive. We finished a seed round around a year ago on the heels of getting a $1.3 million Department of Defense grant. So the SBIR has allowed us to do research and development around building the military grade version of this, and has really opened doors for us to pursue the defense related applications to musculoskeletal bracing technologies, where our special operations communities, which are about an hour away from where we sit in the triangle at Fort Bragg and a little bit further at Camp Lejeune, can leverage these tools to keep warfighters in the fight. So I've described now, it's great to see products keeping an NFL player playing in the Super Bowl a few weeks ago, or a NBA college basketball player and playing in March Madness, or a local individual walking healthy and normal, but now to see our products helping military men and women serving our country is pretty awesome. Yeah, I've met people because we are close to those that meet the special ops folks, and they say, I thought I met people that were in shape, and then I met these guys, and they're in like some kind of next level of being in shape. Has that been your experience? Precisely, and having been in an NFL training facility and 3D scanning some of these people and getting pretty intimate looks at folks of their like weight room and defensive linemen at the highest level can move some people around. But going to some of the special operations communities, I can say you wouldn't want to mess with those guys. Where
do you see the company going? So you've been at it 6 years. So this is another thing. So a couple founder lessons here, and then I'd love for you to chime in on it. Well, let me start with you. What, if you were going to talk to 6 years ago, Kevin, what are some founder lessons you would kind of share that you've learned over that 6 year journey, 6 or 7, I guess?
I think some of the big ones are fail quickly and fail often. So when we make these devices, what are going to be what works for the right types of customers, and we made our foundation in elite sports and elite sports medicine, but making that jump into the clinical community and doing insurance reimbursable products, maybe could have gotten some customer discovery and momentum built sooner. But the technology development and maybe navigating this through COVID in our first couple of years, I don't know if I have advice for people navigating the global pandemic, having just started a company. That one that still escapes me.
Yeah, that one comes down to grit. Like, not many people would be grinding at this for 7 years, and you and your co-founder have, and you still have a smile on your face, and you made it through code and everything. Where does that come from?
Being, I guess, growing up in my family and seeing my parents work as hard as they did, and I was the youngest of 3 brothers, and fend for myself sometimes. And
you're at the bottom of a lot of wrestling matches, I imagine.
That's exactly right. And then carrying that through college athletics and knowing how to work hard and show up every day. And we've built a culture around that, and now everybody at our business kind of rises to that. And again, speaking to the why, but doing so with that, the impact on people at the center of it has been what drives me every day.
About how many folks are in the company now? Can you just range is fine?
Yeah, we have 12 full-time employees, another 5 or so contractors.
And then where do you see this thing going?
We project the company being like a centerpiece of orthopedic bracing in any clinical community. Custom should be the norm, and we've positioned the technology to be prepared for that level of scale, and this should be a routine offering in any clinical patient scenario. We are and will continue to be the go-to solution in the collegiate and professional sports space, and we want to become the go-to provider of these products in the military space as well.
Some companies that do 3D printing, they kind of go down a path where there's actually these service bureaus, like Xometry is one, and I can't remember the names of the other ones, but where you can actually you just submit it to it, and then they FedEx you the thing, so you don't have to have the printers. Do you see getting to that level, or is this where you always, to really deliver the customer level you want, you're going to need to have the 3D printers yourselves?
Good question, and maybe take that a couple different ways. But how do we deliver our products? Some of the primary sales channel for us is through a medical professional. So I say it's like B2B2C. So the end user is that patient who's paying for the product, but we're often selling wholesale and providing the technology to a medical professional, be it at a professional sports team or an orthopedic clinic or a military setting. We do central manufacturing. So we ship a finished good, we ship a medical device to these places. There are definitely models that could do point of care 3D printing, one of which could be in the defense setting where it is forward deployed 3D printing. And that is some of the current R&D supporting that. So the 3D scan to digital design system has to exist in a closed loop capacity. So it's really fascinating to continue advancing some of the automation tools to support that. Back to your other point, Scott, can we support people that are wanting these products just from home? We launched a portion of our website, or launched a new website this past fall, but for the first time, put a section there that was at-home 3D scanning products, at-home products. So you can download our app, pay for a custom face mask. You can buy a face mask for a nasal injury on Amazon. You can now reach out to us on our website and buy and 3D scan for a 3D printed custom face mask and have it delivered to your door days later. So we're kind of a direct-to-consumer market test through the website. So it's really interesting to continue evaluating different sales channels for the technology and the products we've created to reach people that these products can help.
One other kind of founder lesson here is build your startup on a platform or set of platforms that are kind of on a rising tide, and it will kind of be the water that helps lift your boat. So you've kind of invested in scanning technology, digital sports medicine, and 3D printing. It's kind of like, think about that as kind of like three platforms you're sitting on. And just since we've been talking to you guys, the scanning process has gone from like kind of painful and kind of like error prone to holding an iPhone, right? And now that you're on the iPhone, you're on this every year relentlessly a new iPhone, and the cameras have been improving very dramatically. It was a front LiDAR, and now it's a front. It was a back LiDAR, and now it's a front LiDAR as well. I'm sure that helped take is that one of the things that moved the quality from micrometer up to much higher, and then being on these 3D printer platforms, that's basically digital manufacturing. So once you're digital, you're at least on Moore's law, and part of the software, I'm sure, is on faster than Moore's law. It's like on the AI log scale. So it's going to be, by building on those things as a founder, you can innovate on top of that, and it's additive, right? So you're getting some free wins just by being on those platforms.
It absolutely is, and we've tried to stay vertically integrated as much as we can to maintain flexibility there. So not choosing just one 3D printer and one material to build our products in, but keeping the optionality and continuing to innovate there allows us to stay on the cutting edge when new 3D printing technology becomes available. Same thing exactly as you mentioned on the 3D scanning side.
Any other things you want to leave listeners and viewers with before we call it a day?
I think if there's young founders out there that are starting a business, keep at it. The grind doesn't stop, but that's the fun of it. And success is right around the corner, and we've seen that in a lot of different ways. Winning some non-dilutive funding, leveraging the support systems in our Triangle region have been incredible. And yeah, entrepreneurship is fun, especially when you share the struggles and the highs and the lows with people that are going through similar things around you.
Thanks, Kevin. Best of luck with Protected. We'll be cheering for you and supporting you here from Tweener headquarters.
Thank you, Scott, and the Tweener team.
Triangle Tweener Talks is hosted by Scott Wingo, presented and produced by Triangle Tweener Fund, with creative assets and design support from our friends at Walk West. That's it for today's episode. A big thank you to our guests, sponsors, and the team that makes this podcast possible. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who loves the startup stories coming out of the Triangle. Thanks for listening. We will see you next time on Triangle Tweener Talks.